Most people think that an ulcer is a minor inconvenience that can be treated with antacid. But what if I told you that that recurrent heartburn, upper abdominal pain, or bloating can set the stage for stomach cancer? There is a tiny bacteria called H. pylori that quietly hides in the lining of your stomach and cause damage over the years. If it is not treated, it can cause an ulcer to progress to become a stomach cancer. My name is Dr. Peter, and in this video, I'll be showing you how H. pylori can cause an ulcer, a simple ulcer, to become a stomach cancer. So stick with me to the end of this video. You can see that if you look at the stomach lining, if you look at the wall of your stomach, as you can see here, the wall of the stomach produces acid and mucus. The acid is actually used to digest your food, while the mucus protects the stomach wall from the acid. If you look at my slide here, you look at that there's both aggressive and protective factor. The aggressive factor is that which damages this wall of the stomach, while the protective factors are those that protect the wall of the stomach. So what are the aggressive factors? These are the things that damage the wall of the stomach or the stomach lining. Number one, we have H. pylori infection, which we are going to be treating today. The second one is NSAID. For those of you who have low back pain or knee pain or some joint pain, you probably have taken drugs like diclofenac, ibuprofen. Those are called NSAID. They are meaning non-steroidal anti-inflammatory drug. That's the meaning of NSAID. Alcohol is another aggressive factor that can damage the wall of the stomach. We have smoking as well and excess acid. So looking at the factors that protect the wall of the stomach, what are they? We have mucus. I said it earlier that the wall of the stomach produces mucus, which prevents the acid produced by the stomach from affecting the wall of the stomach. Then we have bicarbonate. The stomach also produces bicarbonate. Bicarbonate also protects the wall of the stomach from acid. Then we have prostaglandins. Prostaglandins are just hormones. They're just chemical substances that increase the production of mucus and bicarbonate. Then we have good blood flow. The more blood flows to your stomach, the more repairs of damages can be done. So good blood flow is a protective factor. Then healthy diet. When you eat food that are rich in antioxidant, it also helps to protect the wall of the stomach from damage. So I said it now that we have two factors, the aggressive factors and the protective factors. So if you look at it, we have a scale here with aggressive factor on one side and the defensive or protective factor on the other side. So when the aggressive factor becomes more than the protective factor, you have what we call ulcer. So when this side, aggressive factor, is higher than protective factor, you have what we call ulcer. So that is how ulcers can happen when the aggressive factor becomes greater than the protective factor. So let's talk about H. pylori. We said one of the most important aggressive factor is H. pylori. So H. pylori is like an unwanted tenant living in your stomach, or you can say it's like a termite that lives in a furniture and quietly destroys that furniture over the years. So that is H. pylori, and H. pylori is a bacteria. It's a tiny spiral-shaped bacteria. As you can see in the image here, we have a spiral-shaped bacteria. It's like a corkscrew, like it is twisted. So that is what we mean by spiral. So it's tiny, it's spiral shaped. It has what we call a flagella. You can see these things like hairs on the bacteria. This is called a flagella. It helps the bacteria to move into the wall of your stomach, just like a termite moves into the wood of a furniture to destroy it. So we have it has a flagella. Again, it neutralizes stomach acid by producing a substance, an enzyme called urease enzyme, the urease enzyme. Now, if you look at it, the acid produced by your stomach can cause damage to anything it comes in contact with. So the question is, why is it the acid in your stomach not killing this H. pylori? If you take the acid in your stomach and put it on your skin, it is likely to burn your skin. So why is it not destroying the bacteria? And that's because this bacteria called H. pylori produces a substance that neutralizes the acid. It makes the acid not effective. So, and that substance is called the urease enzyme. Another thing is that this H. pylori can stay for years in your stomach and cause damage. So, it can live in your stomach for years. Again, it's infectious. This H. pylori can be infectious, and we're going to be seeing later in our slide how this H. pylori can be transmitted from contaminated food, from kissing, and all of that. So stick with me to the end of this video to get the full gist of this particular topic. Again, it irritates the stomach lining. It irritates the stomach lining. You know, when something is irritated, it's not a good thing. So an irritation of the stomach lining is what we call inflammation. It's like setting fire on a house. When you set fire on a house, it causes destruction of that house. So this H. pylori causes inflammation. It sets your stomach on fire to put it in that way. So we can see in this diagram too how H. pylori with the flagella, you see it's causing ulcer there. So look at the process. It starts from infection. From infection, it leads to inflammation. And I said inflammation is like you have a house and somebody comes to put fire on that house, to burn down the house. So that is inflammation. In the inflammation stage is what we call gastritis. From gastritis, progresses to ulcer. That is where you see there will be visible wounds in the wall of the stomach, like you can see in this diagram here. Then from ulcer, it progresses to what we call metaplasia. So what is metaplasia? Metaplasia means that the cell or the cell in the wall of the stomach begin to change their form. They change in type. That is metaplasia. It's not a good thing. So the normal cells that are found in the stomach become something different. And at this stage, it is still reversible from infection to inflammation to ulcer to metaplasia. You can reverse it if you detect the condition early enough. So it's reversible. But if this metaplasia, at this stage of metaplasia, something is not done, it can progress to what we call stomach cancer. So that is how ulcer can become stomach cancer, just by starting from H. pylori infection. So practically, how does H. pylori spread? How does it spread? Let me increase my zoom it a little bit more. So how does H. pylori spread? Number one, we have mouth to mouth. For those who kiss, it has been found that H. pylori can be found in the saliva of people. So in the process of kissing, there's exchange of saliva. So, and that's if the person is infected with H. pylori, it can be transmitted to the other person. Then sharing utensils, like somebody uses a spoon, the saliva of the person containing H. pylori sticks to the spoon, and another person uses that spoon and becomes infected. Then we talked about contaminated saliva. Then we have the fecal-oral route, meaning from anus to mouth. So how does infection happen from anus to mouth? For example, it can happen in people who practice anal sex. I would like to let you know that the H. pylori can be found throughout the GI. That means it can pass from mouth to your stool. So if somebody practices anal sex, it can get H. pylori. Another one is if a food is contaminated with feces or somebody's stool that has H. pylori, and another person eats that food, the person eating the food can become infected with H. pylori. So another thing again, if there's a water that has been contaminated with feces of somebody who is infected with H. pylori, another person who is not infected, who drinks that water can become infected with H. pylori. So, and touching surfaces that have traces of contaminated saliva or feces. So if you mistakenly touch a surface that has been contaminated with a saliva containing H. pylori or with a feces containing H. pylori, and you take that hand and put in your mouth, you can become infected with H. pylori. So let's move to the next one. How do you confirm that you have H. pylori? Now we have seen the things that H. pylori can do, that it can cause gastritis, can cause ulcer, cause cancer. How do you know if you have H. pylori? The only way to know you have H. pylori is not by guesswork, it is by doing some tests to confirm its presence. So what are the tests that can be done? We have the stool antigen test. Stool antigen test. The H. pylori has a signature, or will I say a tag? It's just like somebody going around with a name tag. The H. pylori has a tag which is called an antigen, and it can be found in the stool or the feces of of a person that is infected. So they will take the person's stool and look for that antigen, and if it is positive, you can say, oh, this person has been infected with H. pylori. Another one is a urea breath test. I told you earlier that the H. pylori produces an enzyme. If you remember the name of the enzyme, the urease enzyme. So what happens is a person is given a drink and containing urea. So the urease enzyme breaks the urea to release carbon dioxide. So it's that carbon dioxide that is used to test for the presence of H. pylori, because the only way urea can be broken down is by urease enzyme. And what produces the urease enzyme? The H. pylori. So if I can confirm that urea has been broken down, it means therefore that H. pylori is present. So that is how the urea breath test is done. Then a very important test that will show that there is H. pylori is endoscopy and biopsy. Now, endoscopy is when the doctor passes a camera through your throat into your stomach to visualize what is happening in your stomach. So that is endoscopy. And in the process of visualizing, the doctor may decide that he wants to take a piece of the tissue. Say he finds an ulcer looking through the endoscopy camera, he sees a tissue that is abnormal. He can decide to pick that tissue and send to the laboratory to see what they will find in that tissue. So in that tissue, they can find that there's metaplasia or is a cancer, or they can also find that there's the H. pylori organism in the tissue. So that's endoscopy plus biopsy. Another one is the blood test, which is commonly done but is not reliable. It mainly shows past infection. So if a person has H. pylori, I told you the H. pylori has a tag, like a name tag that identifies it, and it's called the antigen. So once a body finds an antigen to H. pylori, what it does is that it produces a substance called antibody. It's just like you find you are in a party, somebody enters your party that you did not invite. What you do is you send your security guard to arrest the person and take the person out. So the body produces antibodies, which are like the security guard to checkmate the H. pylori. So even when the H. pylori is gone, the antibody or the security guard can still be standing to look for more intruders to your party. I said, yeah, you have a party, somebody comes in uninvited, you send your security guard. But after doing their work, the security guard can still choose to stay behind to watch out for more intruders. So it's the same thing. So that's why the blood test is unreliable. If you look for the security guard or the antibodies, so to speak, it may not show it may not show a current H. pylori infection. So I hope you get that. So it's not reliable because it just merely shows past infection. So how is H. pylori treated? H. pylori is treated by a combination of drugs. We have it usually involves proton pump inhibitor (PPI) and antibiotics. So what are proton pump inhibitor? For those of you who have ulcer, you may have seen the doctor prescribe to for you a drug such as omeprazole, which is very common. So, or you go over the counter and you order for omeprazole. Omeprazole is a proton pump inhibitor, PPI. And what does omeprazole do? It reduces the production of acid. So, you want to make the ulcer, you want to heal an ulcer, you will have to step down the aggressive factor. So, how do you do that? You reduce the acid, you kill the infection. So, to reduce the acid, you use a proton pump inhibitor. So omeprazole is just one example. We have other ones like pantoprazole. So then you also kill the bacteria. You kill the bacteria. So that is where antibiotics come in. So in this case, let's go back to where we talk about the aggressive factor and protective factor. You see, we are dealing with the H. pylori infection and we are dealing with excess acid. So H. pylori infection, you use antibiotics. For excess acid, you use the proton pump inhibitor. So if you look, let's go back to where we were. So how do you do that? So we have what we call triple therapy. Triple meaning you are using three drugs. So what are the drugs? A proton pump inhibitor like omeprazole. Then you combine it with amoxicillin and clarithromycin. So you may have seen your doctor prescribe three drugs combination like omeprazole plus amoxicillin plus clarithromycin and say you should take it between for 7 to 14 days. Yes, then there's another one. There's the four drug combination, which consists of proton pump inhibitor, amoxicillin capsule, clarithromycin tablet, and flagyl. That's four drugs now. Another combination could be proton pump inhibitor, bismuth salicylate or bismuth citrate, and tetracycline and flagyl. So these are the various drugs combination. So and the duration is usually between 10 to 14 days. Some give it for 1 week. So, but the thing you should note here is that you should never stop your antibiotics halfway. You should complete your treatment course for the duration. And incomplete treatment can let the bacteria survive and become stronger. That's what we call antimicrobial resistance. So you want to prevent that. So we have the alarm symptoms. What are alarm symptoms? Alarm symptoms are warning signs or warning symptoms that show that something serious is going on that you should not ignore and that you should present at the hospital at the earliest opportunity for evaluation and treatment. So what are the alarm symptoms? So if you see these signs, it means you should rush quickly to see a doctor and get evaluated and treated. So what are they? Number one, we have vomiting blood. Some people have ulcers and they are vomiting blood. That is a serious sign. Vomiting blood can cause your blood level to drop. That means your PCV goes down, leading to what we call anemia, shortage of blood. Okay, so it means you should not allow the vomiting blood to persist. You should present at the hospital to be so that their bleeding can be arrested. Then we have black stool. Black stool is also a form of bleeding. It's bleeding too. You vomit fresh blood, but once the blood passes through your digestive system, it becomes dark. That is why the stool is black. So when you are having black stool, recurrent black stool that is like very dark, like a coal tar, it shows that you are bleeding inside your digestive system and you should present at the hospital at the earliest opportunity. That's because as you continue to lose blood, your PCV will be dropping. As your PCV is dropping, there'll be shortage of blood. You will easily get tired. Your heart will be beating fast. You could faint, and it can lead to death. Okay. Another one is persistent vomiting. When you have vomiting that will not stop, that is another alarm symptom you should not ignore. Then we have weight loss. Weight loss that you cannot explain. You are losing weight. You should present at the hospital. In fact, one of the signs of cancer is that you will be losing excessive weight even though you are eating. Yes, there are other conditions too that can present with unexplained weight loss, but if you see weight loss and you are having ulcer symptoms, please do not ignore it. Another one is difficulty swallowing. You find that you can no longer swallow food. you are finding it difficult to swallow, or you are having pain when swallowing, you should not ignore it. Another one, again, the last one is worsening abdominal pain. If you have the stomach pain, formerly it comes once in a while, but now it's now intense, and it's intense and it will not stop, then you should present at the hospital. So, what are the prevention tips for stomach ulcer and cancer? Prevention, they say, is better than cure. So, what are the things you can do to prevent stomach ulcers and cancer? Number one, since we have identified the causes like poor hygiene, alcohol, so the prevention tips is tailored to eradicating the things that can cause infection with H. pylori. So what are they? Wash your hands regularly and practice good hygiene. Avoid sharing utensils, cups, or food. You want to minimize contact with other people's saliva, because I said it that some people's saliva contain H. pylori. Then avoid unnecessary NSAIDs. Like if you have, so those who are suffering from arthritis or lumbar spondylosis, low back pain, all those degenerative joint disease, avoid using NSAID. Yeah, you could use paracetamol or some other combination. If you have ulcer and you take this NSAID, you could worsen your ulcer. Then limit alcohol and quit smoking. Manage stress. Manage stress, because you know stress can worsen ulcer. If you have ulcer and you're stressed out, you can lead the stomach to secrete more acid than usual, which can worsen ulcer. So eat a balanced diet rich in fiber, fruits, and vegetables. That's because a healthy or balanced diet contains minerals, vitamins, and antioxidants that can protect the stomach lining. Then, if you have been diagnosed of H. pylori, you should complete your treatment. Don't stop your treatment halfway. And then, if you see the alarm symptom, please try to seek medical attention early enough. So that brings us to the end of this video. I hope you have gained knowledge. I want you to subscribe to my YouTube channel for more content like this. Share this video. There could be somebody who needs this information. And see you in the next video. Bye for now.